Hi, we're Group 8. I'm Paloma.
I'm Grace.
I'm Jair.
I'm Mia.
I'm Xochilt.
I'm Andrea.
And this is our Historical Nursing Advocates and Leaders presentation. Our nursing advocate and leader is Lauren Underwood.
Lauren Underwood attended the University of Michigan, becoming a registered nurse, and later became involved in the government, now representing the 14th District of Illinois. In her career focused on public service, she uses her nursing and policymaking skills to reform healthcare for the public good. She consistently advocates for public health issues, including health disparities affecting Black birthing people, low-income communities, marginalized groups, and working-class families. Some major policies she helped pass include the Affordable Care Act, the Healthcare Affordability Act of 2021, the Black Maternal Health Omnibus Act of 2021, and the Short-Term Limited Duration Insurance Rule Prohibition.
We define moral courage as a person's ability to overcome fear and stand up for their core values. Social justice can be defined as the active work to break down barriers of access to healthcare opportunities, treatments, and other resources for all individuals, regardless of their background and status. Underwood uses her background in nursing and place in Congress to integrate her moral courage into fighting for social justice in several disparate aspects. She has introduced legislation about public health issues for people of color, veterans, communities affected by the COVID-19 pandemic, and more. One example of a legislation is the Black Maternal Health Omnibus Act of 2021, which addresses the social determinants of maternal health and has helped people have access to childcare, housing, food security, and more. She serves as a voice for marginalized and underrepresented communities in the government and focuses on minorities to fight health barriers.
Underwood redefined the typical image of nursing. Usually when people think of nurses, they think of a bedside caretaker, but in Underwood's case, she did more than that. She had a multitude of different roles. Underwood exhibited the quality nurses strive to project within the nursing profession, which is acting for change. Acting for change is a quality where a nurse uses their knowledge to help better the community in ways that go beyond the scope of the job. Two characteristics of acting for change are being a resource and being part of the legislative process.
Having served as a senior advisor in the U.S. Department of Health and Human Services, she was able to become a resource for the community where she worked in order to help improve the health of the majority and the betterment of the large population. Her work furthers as an advocate through her position in the 14th Congressional District of Illinois. There she has passed 42 pieces of legislation, 15 of those out of the House, and 3 having bipartisan pieces of legislation signed into law. She has used and contributed her unique insight to determine resources and policies needed to support communities, especially marginalized communities.
One major contribution comparison has to do with her work in policymaking. Representative Underwood's advocacy transcends a clinical setting, showing the extent to which nurses can influence legislation. She has transformed the image of nursing through expanding healthcare access for marginalized communities, those that are low income, are racial minorities, and those with pre-existing health conditions. Representative Underwood has fought for social justice through political actions. However, her presence in Congress as a Black woman continues to influence both healthcare reform and medical inequalities.
Through her image, Lauren Underwood transformed the image of nursing through participating in policy legislation. By becoming the first Black woman to represent Illinois' 14th District in Congress, Lauren offers a positive perspective to the development of legislation. Perspective and influence allows to address barriers in healthcare, creating greater accessibility for all communities. Her influence and image have become a voice for women, minority communities, and medical professionals, becoming a source of inspiration to continue developing healthcare reforms.
Teamwork reflection. So as a group, we started by agreeing to write the essay together over Zoom and communicate with each other over GroupMe. And after any meetings, people who weren't able to come to the meeting, they made sure to reach out to the group and find any makeup work. We also agreed that next time we could improve by bettering communication and maybe helping to resolve those schedule conflicts ahead of time to prevent any issues down the line. And we would definitely make sure to check GroupMe more often in order to maintain that communication. And we have our references here. And thank you.